Hello and welcome to my presentation on acromegaly. Acromegaly is caused when the pituitary gland makes too much growth hormone. Growth hormone triggers the release of insulin like growth factor 1 in your liver, and this hormone promotes bone and tissue growth. Acromegaly is commonly caused by tumors, and in 95% of cases, it's a pituitary gland tumor. And this tumor secretes an extra GH in addition to the GH produced normally by the pituitary gland, which just leads to an excess of GH. There are also non-pituitary gland tumors, and these can be found all over the body, like in your lungs and your adrenal glands, just to name a few places. And either this tumor produces additional GH, or it produces a hormone that triggers the release of more GH. Some symptoms of acromegaly are enlarged hands and feet, changes to the shape of the face, excessive sweating or BO, coarse skin, impaired vision, headaches, deepened voice, fatigue, and muscle weakness. The diagnosis, or doctors can use a variety of diagnoses in order to pinpoint whether or not you have acromegaly. First up is the blood test, and this just simply measures the level of GH found in your bloodstream. Next is the growth hormone suppression test, and this is a definitive test for acromegaly, meaning that if these results come back positive, you know for sure it's acromegaly and not some other disease. And in this test, hormone levels are measured before and after the patient drinks a solution of sugar. Normally, glucose suppresses growth hormone, but in acromegaly patients, these GH levels remain high even after their glucose solution. Doctors can also use MRIs to spot a potential tumor. Some treatments available for acromegaly patients are surgery, where they simply remove the tumor. There is also a variety of medicine available. Somatostatin analogs and dopamine agonists both work in the same premise, where they both try to decrease the levels of GH found in the blood. Growth hormone antagonists just work to decrease the effect of GH on tissues and bones. There's also radiation, which tries to shrink the tumors. Some of the latest advancements in the treatment of acromegaly is doctors are using a combination of somatostatin analogs and growth hormone antagonists, and they found that this combination of medicine is very effective and is more effective than these medicines individually. There's also oral medication on the rise, and that's a positive because now this medicine is having to be delivered by injections once a month, and injections don't appeal to everyone, so oral medication is being developed. There's also longer lasting injections so that patients won't have to come in once a month, and it'll give them a couple months in between. Some patients have been cured of acromegaly, as in they've been able to get off their medicine, but in most cases acromegaly is a lifelong disease, and no predictor has been found whether or not a patient could or could not stop taking their medication. Here's my works cited, and thank you very much.